Hi, my name is Michelle Groves. I am the clinical nurse leader for the operating room and endoscopy suite at United Memorial Medical Center. I've been a nurse for 30 years and 20 plus of it has been in surgical services. An operating room nurse is responsible for quickly forming a relationship with the patient prior to going to sleep for their procedure. We're going to be checking to make sure they've had all their lab work. We're going to check to make sure their consents are in place. And then we are the eyes in the room. We take the patient in, we observe the procedure, we make sure sterile technique is being observed, and we do all the documentation. A routine operation for a surgical nurse, the priorities would be first to go in, make sure that we have all the supplies that we need. We help our scrub tech open up the room. We count all the instrumentation, all the sponges, all the equipment that's necessary. We test all of our equipment, and then we go out to the ambulatory surgery area and we check our patients in. We check to make sure that they're wearing their name band, that they haven't had anything to eat or drink, that they've done all the appropriate lab tests prior to surgery, and that their consents are in place. And we get them to start to trust us before we go to the room. A typical work day for us here at United Memorial is we work 10-hour shifts. So we arrive, we have a 7 to 5 shift, but I arrive about 6:15. I look through the day's schedule, I make sure the assignments are appropriate, and then we have a huddle. We do a safety huddle with our whole team at 6:50. So we talk over what the day brings, what cases we have, if we have any safety concerns that we're looking at for the day, and then we send our teams out to start their rooms. So we at 7 o'clock would start opening a room, counting, making sure we have everything we need, and then by 7:25 we're out in the ambulatory surgery area checking in with that patient, making sure we're ready to go to the room. We would repeat this for however many surgeries we had. We have an EDS team that comes in and assists us with room turnover and cleaning. So at the end of the day, we make sure we put all our extra supplies away, we check our rooms, we make sure the room is set up so that if we get called in the nighttime, everything is there. And at 5 o'clock, if all the cases are done, we get to go home. We have a late team that stays from 5 to 7, and then we have an on-call shift that starts at 7 p.m. and covers us till the morning time. I actually initially thought I wanted to be a teacher, and the market was so flooded with teachers in the the late 80s, early 90s that my guidance counselor said, take a look at nursing. Nurses teach. So I fell in love with nursing. I went to nursing school and absolutely loved it. Started out as an emergency room nurse and an ICU nurse, and then transitioned into the OR after I had kids. Well, I did my nursing education at Genesee Community College, and I graduated back in 1993 from their program. And then I'm currently taking a BSN to Master's Bridge program through Aspen University, doing online college. So that is something that I've been working through. But the classes that would be important to focus on in high school would be math and your sciences, especially biology and chemistry. You're going to have a strong foundation in math because there's a lot of dosage calculations that you need to do, and sciences, your biologies, anatomy, physiology, making sure that you have a good understanding of the human body, how it works, and chemistry. Benefits here at United Memorial Medical Center. I have several weeks vacation. I have paid holidays. The operating room is a special area that is not open on holidays or weekends, so it's just on call. So instead of having to work every other weekend like you'd have to work every other weekend on the floor, we have on call, and it's typically 1 out of 8 weekends. Holidays, we're on call 1 holiday a year, and being on call doesn't mean you're actually going to work, it means you're available if there's an emergency. So that's kind of a perk of being in the operating room. We have paid holidays, we have retirement match, we have a investment match. They offer opportunities to further your education and help reimbursement with college expenses, and pay for certifications. If you want to become certified in your specialty, that study course is paid for and the exam is paid for, and then you get a little benefit in your paycheck as well. So my most rewarding, and it will be something that will, and I can see the pictures in my mind every day, I had the opportunity to be a scrub nurse on a twin C-section delivery, and these twins were born far too early. They were born at 28 weeks. We were worried if they would do well, if they would live, if they would make it, and they have thrived. They've done beautifully. They are, I think, 8 or 9 years old right now, and it's a story that will live with me forever. It was incredible. What I like most about my job is seeing a positive difference in each patient each day. I've worked in a lot of different aspects of healthcare, and one really beautiful piece of being in the OR, you see somebody, you come in, you make a positive impact on their life, and you see the change immediately when they leave. They come in, something's broken, we fix it, we send it out fixed. You come in, you're having belly pain, we fix it for you, send you out fixed. So I love the fact that we're making a positive impact, and you can see that immediate return. And I also love how technical it is. I am a tech junkie, and I love technical aspects of care, and we have a lot of high-tech opportunities here. What I find most challenging, and I think that this is probably across healthcare in general right now, is the staffing in the workforce. It's hard to really recruit quality candidates that want to stay and be hard workers. So I really think that staffing and the challenges with staffing right now are what make this one of the more difficult times in healthcare. But there's probably not a thing about my job that I don't like. I love everything I do within the operating room. The beautiful thing about being a nurse are that there's so many different opportunities, so many different aspects of nursing. You can work in a hospital, you can work in a clinic, you can work in a doctor's office, you can work in industry, you can do research. There's so many different things. Being a nurse is so versatile, you'll always be needed. And there's opportunities for growth within whatever department you work in. I started as an ICU emergency room nurse and then transitioned into the OR. I've had an opportunity to grow and become a leader within the operating room, and currently I'm functioning as the clinical nurse leader. There's management opportunities. The opportunities within healthcare and nursing specifically are just limitless.